Third one, big Q wave, which is practically similar as a R wave. AVF, Q wave. So second, third, and AVF has a Q waves. ST segments are normal. T waves are absent. It could be like a semi-normal case. So what is conclusion if there is Q wave? Q wave is always myocardial infarction. Next, what is stage of myocardial infarction? There is Q wave, ST segment, and T waves are normal.
Subacute.
Acute stage, I said you, there is Q wave and elevation of ST. Two necessary things.
Superacute.
Superacute, there is no Q wave.
Oh.
In our case, there is Q wave, R wave, and normal ST and T. Stage number 4. Patient has, it's depend on period, but we can conclude post-infarction cardiosclerosis. It is old myocardial infarction. Patient had it before. We don't know when. V1, no R wave, QS wave, elevation of ST. V2, there is small R wave, deep S wave, elevation of ST, biphasic T. V3, R, S, ST, biphasic T. V4, R, S, elevation of ST, biphasic T. V5, R, elevation of ST, biphasic T. V6, elevation of ST, biphasic T. So, if there would not this lead, it is ischemia only. There are no Q waves, but in this lead there is Q wave. So it is myocardial infarction. What is stage? There is Q wave and elevation of ST.
Third.
Second, acute stage. Q plus elevation of ST. R wave is absent in this lead, that's why it is transmural myocardial infarction. Quality is okay. P waves are present. Regularity is not available. There are only two complexes. Next, second lead, QS wave, QS. Third lead, QS, ST segment is on either electric line, T is negative. AVF, always if you see changes in second and third, you need to check AVF. QS, normal ST, negative T. What is conclusion?
Superacute.
Subacute myocardial infarction. Which wall is affected?
Inferior.
Inferior wall. Big focal or transmural? There are no R waves, so it is transmural. Subacute transmural myocardial infarction in the inferior wall. Let's check chest leads. QS, elevation of ST, big T. QS wave, elevation of ST, big T. QS, elevation of ST, big T. QS, elevated ST, R, S, normal ST and T. R, S, normal ST and T. So, in these leads, there are signs of myocardial infarction. There is Q wave. What is stage? Q wave plus elevated ST. Acute stage. Acute stage of myocardial infarction. Is it big focal or transmural? If there is Q, R, and ST, T, undependent on force conditions, it is big focal. If there is QS and no R wave, it is transmural. So this one is a R wave or not? No R waves. That's why it is transmural. Locations. V1, V2. What is location? Anterior wall. V3. Septum. And V4 is apex. If V5 and V6 would be affected, it would be also lateral wall. Now it's without these two leads. Quality. P waves. Rhythm is regular. First lead, small Q wave. Everything is normal with ST and T. Second lead, big Q wave in compare with R1. ST segment is normal, T is normal. Third, Q wave, small R wave, S wave. ST normal, T normal. There are Q waves in the second and third lead. So we need to check AVF. AVF, Q wave, normal ST and T. So second, third and AVF have a Q waves. ST segments and T waves are normal. What is conclusion? Myocardial infarction of the inferior wall. What is stage? ST and T are normal. Fourth stage. Post-infarction cardiosclerosis. It is old myocardial infarction. Patient had it before. Next. AVL negative T, V1. Small R wave, S wave. ST segment and T waves are normal. V2. No R wave. It is QS wave. ST segment is a little bit elevated. 2 millimeters is enough to conclude ischemia. T wave is biphasic. V3. QS elevated, a little bit elevated ST segment. T. V4. QS a little bit elevated ST segment. QS, QR small s, elevated ST a little bit. V6. Q wave. ST segment and T waves are normal. So, is the myocardial infarction one more or not? Q waves. So, myocardial infarction is present. Stage. ST segment is very close to isoelectric line. So, if we know history of patient and patient is sick more than 1-2 weeks, it could be subacute stage. It is beginning of subacute stage. If we don't know this history, we can conclude acute stage 2. It will not mistake. Location. V1 is affected a little bit, but V2 is affected. So, what is wall? Anterior. V3? Septum. V4? Apex. V5, V6 are affected to lateral wall. So patient has myocardial infarction anterior, septum, apex, lateral wall, and old myocardial infarction in the inferior wall. So patient has total myocardial infarction. Quality. P wave is here. P waves in the second lead are present. First lead, depression of ST segment. Second lead, elevation of ST segment. Q R small s. Third lead, QS, no R wave, elevation of ST, biphasic T wave. AVF, QS, elevation of ST, biphasic T. AVL, depression of ST segment. V1, V2, V3, V4, V5, V6 are normal. So we can see changes in first, AVL, second, third, and AVF. Is a myocardial infarction or not?
Yes, one.
Because of
Q wave.
Q waves are present in the second, third, and AVF. Second, third, and AVF has a Q waves. R waves are present or not? In this lead. If even in one lead R wave is absent, it is transmural. So in this case, where is R wave?
Yeah.
Q are small, R is below than isoelectric line. It's like absence of R wave. So transmural. Next, ST segment is elevated. So what is stage? There is Q and elevation of ST. Acute stage. Wall is inferior wall. First and AVL has a depression of ST segment. It is concordant changes. First and AVL look at the another wall of the heart, opposite wall. That's why changes will look like a turn. If we will turn this heart, we will see big QS wave, elevation of ST, biphasic T, like in third and AVF. It is concordant changes, opposite changes. So it's not a ischemia in the anterior wall, it is just electricity from the opposite side. This one. Quality is okay. P waves are invisible. In the second lead, P wave is visible. So rhythm is sinus. Rhythm is regular. There are elevated ST segments in every one lead. So it is ischemia, stage of ischemia, plus there is tachycardia. Patient has a ischemia, and to know is it myocardial infarction or not, we need to do troponin test. If troponin test is positive, it is super acute stage of myocardial infarction. Quality. P waves. They are present. Rhythm is regular. Electric axis of the heart is normal. First lead, negative T. Second lead, everything look okay. Third one, T wave may be a little bit bigger than normal. AVL, negative T. AVF is normal. V1, very small R wave, but R wave is present. It is S wave, elevation of ST, biphasic T. R, S, elevation of ST, biphasic T, or practically negative T. R, S, elevated ST, negative T, negative T, negative T, negative T. Is the myocardial infarction or not?
No, because no Q.
No Q wave.
So no myocardial infarction.
Q wave is before R wave. R wave still present. It's very small. Small R wave is one of the criteria of myocardial infarction. But currently we don't know exactly. We need to clarify it. We need to prescribe troponin test to know is it myocardial infarction or ischemia. If we will spend 1-2 hours, this R wave will disappear and it will myocardial infarction. Currently it is first stage, super acute stage, if troponin test is positive. Quality. P waves. Rhythm is regular. First lead, everything look okay. Second lead, Q, R small, S, elevation of ST. Third lead, QS, elevation of ST. AVF, QS, elevation of ST. So, what is it?
Myocardial infection.
Inferior wall, stage acute, big focal or transmural,
Percent of R's. Big.
no R wave.
So transmural.
Transmural. If you will see R waves everywhere, but in one lead R wave will be absent, it is transmural. It could be affection of heart like this. Big area is affected, but in one place it's affect whole wall. Leads which will look at this place will show us R waves. Lead which will look at this place will not show R wave. So transmural is worse, that's why this is the worst stage. Transmural is conclusion. Quality. P waves. Rhythm is regular. First lead, negative T. Second one, everything is okay. Third one, everything is okay. AVF is okay. AVL, negative T. V1, QS. ST is close to isoelectric line. T may be a little bit elevated. V2, QS, elevation of ST, biphasic T. V3, QS, elevation of ST, biphasic T. V4, QS, elevation of ST, biphasic T. V5, negative T. V6, negative T. So, first AVL and all chest leads are affected. And necrosis is present in these leads exactly. In these leads are only ischemia. So, myocardial infarction because of the risk Q wave. Transmural or big focal? Transmural because of no R waves. Next stage. Acute because of the risk Q plus elevation of ST. Location. First AVL plus V1, V2. Anterior. V3. Septum. V4 is apex. And lateral wall start to be involved. Quality. P waves. Rhythm is regular. Electric axis of the heart is shifted to the left. First lead, look okay. Second one, Q wave. ST is normal, T is normal. Third, Q, R, ST is normal, T is normal. AVF, Q, R, S, ST normal, T normal. So, second, third, and AVF contain Q waves.
So
Myocardial infarction is present. ST is normal, T is normal.
So fourth
Fourth stage. Post-infarction cardiosclerosis. Which wall?
inferior.
Inferior. Big focal or transmural?
Big.
R are present.
So big focal.
Big focal. V1, R, S, ST, T. They are normal. V2, R is absent. It is QS wave. ST is close to isoelectric line. T is negative. V3, QS. ST is close to isoelectric line, but a little bit elevated. T is negative. V4, same. V5, same. V6, Q wave, small R wave. It's higher than isoelectric line, so it is R wave. S, ST, normal. So in this leads, there is one more myocardial infarction. Big focal or transmural? Transmural, because of absence of R waves. ST segment elevated a little, and we can think that it starts to go down, plus negative T. It is subacute stage. But if we know that patient had history of disease more than 1 week, if it is new case, it could be acute stage 2. First lead, elevated ST segment. Second lead, big T waves, bigger than 2/3 of R. AVL, elevated ST. V1, R wave, very small but present. V2, no R wave, QS, elevation of ST. V3, QS, elevation of ST, very big T waves. R, elevation of ST, elevation of ST, and maybe big T. So V1, V2, V3, V4 are affected exactly. There is QS wave. That's why it is myocardial infarction. Transmural or big focal? Transmural, because of there are no R waves. And location. V1, V2 is anterior wall. septum,
Apex,
apex.
lateral.
Lateral wall may be a little bit involved, but not clear.